Good afternoon, Mr. Fazel. How are you
Hi,
doing?
good afternoon. Very well. How are you doing?
I'm very good, thank you. For those who might be new to your face and to mine, so you are Mr. Maisam Fazel, and you are, please correct me, but I think you're an Onco Plastic reconstructive and aesthetic surgeon.
That's correct. Yes, yes.
Brilliant. And those who don't know me, I'm Nadia, and I'm one of the directors at Macom Medical. And today we're going to be talking about the Explant, the macom Explant bra, and also about Explant surgery, which is breast implant removal without re-augmentation. I was trying to find a little bit of statistics prior to you agreeing to do this little talk stroke interview with me. Unfortunately, I couldn't actually find any statistics relating to explant surgery. Obviously, with breast surgery, there's lots of statistics available, but maybe we're just a little bit ahead of time, I suppose, in finding out the statistics. Or do you have any at hand that you could share with me?
Yeah, it's a really interesting thing, actually, because in my own practice, I have to say that, I've been doing this for close to 11, almost 12 years. And year on year, I've seen a gradual increase in the number of people asking for an explant. So it's definitely an increasing trend. I don't believe nationally we have any robust statistics about this, because relatively it's a very small percentage of people who choose to have their implants removed. But it's definitely a growing trend. And I suspect that as it becomes more common, and we should be able to have some statistics perhaps in a few years or so.
Yeah. Okay, well, time will tell. So
Yeah.
why do women have breast implants removed? Why is it happening?
Nadia, there's a number of reasons why women choose to have their breast implants removed. I think I would break them down into four categories. The first is lifestyle. People often might have a breast implant when they're younger, not always, but when they're younger. And then as they got older, they feel they no longer need them, or their lifestyle has changed, their criteria has changed. And in that sense, they feel they no longer need that extra volume, so they might choose to have their implants removed. The second category is patients have had complications with breast implants. So breast implant surgery is extremely safe. It's very common. And 98, 99% of patients will have a completely uneventful recovery period. But ongoing maintenance of implants, for example, some patients may develop a capsular contracture, might have the implants changed once, but get the capsule formation again. Or others might have had an implant rupture, and they might come to the decision that they no longer want to undergo this sort of routine maintenance surgery, and perhaps they might wish to, at that stage, have the implants removed. So that's the second category. The third is ALCL. Now, this has become quite topical. This is a breast implant associated, it's a type of lymphoma of the breast.
Yeah.
And fortunately, it's extremely rare. I mean, the MHRA quoted as about 1 in 24,000. So that's very rare, but it's become quite topical.
Yeah.
And for patients who have had the tests and have confirmed ALCL or have suspected ALCL, then the treatment would be to remove the implant and also to remove the capsule surrounding the implant in the en bloc fashion. And then lastly, we're increasingly seeing patients who defined as having breast implant illness. And these are patients who, for various reasons that we might touch upon this a bit later on, feel that they have symptoms of being generally unwell because of their implants. And almost as a last resort, they'll decide to have their implants removed to see if they feel better. But certainly it's something that we're seeing an increasing growth in. So I'd say those are the four reasons.
Yeah. Yeah. Breast implant illness, which a lot of people would also refer to as BII, which is the shorter term. That is something we definitely notice from our end at Macom. We get more inquiries about. So in your word, what is BII or breast implant illness?
So breast implant illness, I think the first thing to say is it's not really a recognized medical condition at present. And I think at present is the key word there, because there's, in my experience, and I think talking to my colleagues as well, there's definitely a small, very small group of patients in whom there seems to be a constellation of symptoms ranging from fatigue, weakness, joint aches, pains, having a slightly fuzzy head, headaches, all these sort of symptoms. And they've had lots and lots of tests at the GPs. Some of them have been to see a specialist and have undergone autoimmune tests, and nothing has been found. And then almost as a last resort, it's been postulated that their symptoms might be related to having these implants in. Yeah. So they then decide to have their implants removed to see if they feel better. And in my experience, a lot of them, almost all of them, will say that they feel better. Now, this could be a placebo effect, that they feel better because something has been done. But it might be something that's real. And I think at present, we just don't know. And I certainly think a lot more research needs to be done into this, and actually is now being done into this. But that's an important sort of aspect of all of this, that, you know, there is this condition out there that patients are experiencing. Yeah. And we as the medical professionals need to make sure we take it seriously. Yeah. And of course, you know, when you have your implants removed, there's absolutely no guarantee that you will feel better. And that's something that the patients need to be aware of before having their implants removed.
Yeah. I mean, likewise, in a way, obviously, when you consult someone for breast implants, you know, initial consultation, you can't say that you will or will not get BII or any risks. So I suppose it's the same, but in reverse, having implants removed, there's no guarantees with anything. Sorry, go on.
No, I was going to say, absolutely. It's all about having sort of an open consultation with your surgeon at the time.
Yes, exactly. Open conversations, you know, essentially patient needs to have valid consent, but having open conversations, I think that is key word. Another thing we keep hearing a lot about is the technique of en-bloc capsulectomy. And I think a lot of patients, they sort of ask for this technique. Not everyone is 100% sure what that exactly means. So what is en-bloc and capsulectomy? What does it mean?
So an en-bloc capsulectomy really is a technical description of how the capsule is taken out. And what it really means is it's removing the entire capsule, the scar tissue that surrounds the implant, but doing it in a way that the implant is still contained within it. And the rationale is that, you know, if you have anything within the capsule, it shouldn't spill out into the breast pocket as you take it out. So you take out the whole capsule with the implant inside, and that's an en-bloc capsulectomy. This ensures that all the capsule has been removed. And I really think there's one clear indication to do that, and that's when you have a diagnosis of ALCL, or when you have a strong suspicion that you're dealing with a patient who has ALCL. Having said that, there's lots of patients who, for various reasons, want their implants removed, particularly the patients who are having them removed for breast implant illness. They will often request an en-bloc capsulectomy. And in my practice, I will explain to them the pros and the cons, the risks, the ramifications. And as long as I'm satisfied that they understand this and they're happy to proceed, then I will do an en-bloc capsulectomy for those patients as well, wherever it doesn't pose a risk to them.
Got it. And how long does an explant procedure with en-bloc and capsulectomy take?
Oh, Nadia, this is a really important question, because you know, I've been online and I've looked at stuff on YouTube and even on the patient forums, etc. You know, what really upsets me is that the general message out there is that this is an operation that takes 3 or 4 hours. It's a major operation. But the reality is that any operation has risks, and occasionally an operation can take longer than expected. But in my experience, an en bloc capsulectomy should not take longer than an hour, maybe an hour and 15 minutes at the most. And it's done as a day case procedure. And I think that it's very important to inform patients, but it's equally important not to frighten them and give them sort of a scenario that terrifies them.
Yeah. No, see, I thought it was longer than that. And I've read quite a few, I mean, horror stories when, you know, there had to be a lot of scraping and patients are, you know, under general anesthetic for quite a long time. So I think that's quite reassuring to hear to a lot of people considering this procedure. So what do patients tend to worry about the most?
You know, the first thing they worry about is how long will the surgery take? So we talked about that. The second is how will they look afterwards? Obviously, this is the biggest concern. So if you think about it from the patient's perspective, you know, they had the breast implant in the first place to be bigger, to be fuller. And now they're sort of going back, reversing that. But in addition to that, you then have the fact that the implants have been there maybe for a few years, and the skin is stretched, aging has taken place. So they're worried about loss of volume, loose skin, and sagginess. And that's a really big concern. When you remove the implants, one thing that is going to be clear is that there will be a loss of volume. And depending on the quality of the skin, the size of the implants, and how long they've been there for, there may be some droopiness and the need to tighten the skin. So things that we talk about at that stage are the possibility of some skin tightening procedures, which may involve a scar, for example, around the nipple or around the nipple and down like a lollipop, which may also be combined with an uplift if that's needed. And then lastly, you can combine all of this with some fat. So to take some fat from the patient and to fat graft it into the breast, if the patient has fat, of course. And that can sort of reduce some of these issues or concerns that patients have.
Great. I think you already answered my next questions. So it's a day case procedure, right? Most of the time.
It's a day case procedure, that's right. Okay. So patients would come in, and as long as they're medically well, they go home the same day.
Yeah. And how can a patient expect to feel after the procedure when you come around from your anesthetic and then you leave? How do patients explain to you they feel afterwards?
So the way that most patients describe it to me is that they have discomforts, the sort of thing that you might have if you went to the gym and you had a sort of big chest workout, you didn't warm up, and the next day you feel pretty sore. So that's how they feel. I don't use drains. I don't think there's any need to use any drains. So that's one less worry. But we give them painkillers for a week. Most patients, in my experience, will take painkillers for about 3 or 4 days. And then after that, they might take a paracetamol as and when needed, but it's pretty unusual. And I would say that roughly after about a week, maybe 10 days, they feel able to drive. Most patients, if they've got a desk-based job, will probably be back to their jobs in about 10 days, 2 weeks, sometimes faster, actually.
Brilliant. So up until last year, we at Macom, we really didn't have anyone call us up and asking about explant procedures, and it was rare. I mean, 5 years ago, it was hardly anything at all. But we noticed over the years, we had more inquiries, and we've always had a bra for explantation, which was similar garment we also use for transgender or top surgery. So it's a full compression bra, which was not the bra we're about to talk about today, but it's a bra which is, I brought a black, wasn't great, but it's a full compression bra. But then with obviously inquiries trickling through more for explantation, we decided to do a little bit of research into this, and we asking patients, you know, how they felt wearing compression after having explantation. We got involved with people like yourself. So we met at BOPS in October last year, and we had a good chat about the explantation procedures and the compression that would be needed. So the previous bra we had is full compression all over. And then we started talking about creating a retractable bra. And that's where our conversation sort of started. And we created this, which is a bra which retract back and help to mold the remaining breast tissue into the sort of a firmer, well, pre-surgery form. So that's obviously how we started talking. So what would you, in your words, why would an explant bra be important, and how can that help a patient heal?
I remember our conversation at Barb's really well, actually, because you see, at that stage, I was doing these procedures, but I really wasn't happy with the bras that were available because they all had a high compressive element to them. And I felt that they were squashing the breasts almost into sort of fried eggs, which was really not the point of what we were trying to do. So in my view, the bra has to help reduce swelling, has to reduce seroma, but also has to be supportive and help mold the residual tissue into a decent breast shape. And that's why, when we're speaking about designing this bra, I think the fact that, the cup area is expandable is really important, because it really does sort of help mold the new breast, as it were. And, of course, you're going to continue to control the seroma, the swelling. But the other important thing that I think really helps is the fact that we've got a very, very well-defined inframammary crease there, which I think really helps in the post-settling period. So that's what we're really looking for. And I think for the patient to wear this and to maximize the best outcome they can get at implant removal surgery, which is always going to be a challenge, I think a good bra is really important.
Brilliant. Apart from compression, is there anything else a patient can do to sort of optimize the healing journey?
Yes. So I would say that something like manual lymphatic drainage can be helpful. It's not essential, but I think, and particularly now with the COVID issues, it may be tricky to organize. So I think that is helpful. And then, the other things that are always good to do is to be up and about, mobile. But, I really can't stress the importance of having the right bra, which has to be sort of comfortable as well. Because if it's not comfortable, they won't wear it. And it has to be supportive. It's not a torture instrument. It's really for helping the correct shape to develop.
Brilliant. And how long would you recommend a patient to wear an explant bra after the procedure?
I would suggest they wear it for at least 6 weeks, because most of the healing takes place over that period. If they feel there is some swelling beyond that, then I would say maybe up to 3 months. But that's a judgment I make when I see my patients at the 6-week check to see if they need to wear it for longer.
Great. I think a lot of patients also say it's sort of, it's like a mental thing as well. You feel quite secure wearing compression afterwards as well.
Yeah, I noticed it, actually, yes.
Do patients tell you that as well?
They do, actually. Initially, they are a little bit hesitant about wearing it. And then when it comes to 6 weeks, they're a bit reluctant to take it off. Yeah.
I find that obviously when patients call us back and we sometimes get asked, how long should I wear it? Then we always refer that back to the surgeon. And then if the surgeon says, well, you're okay, you don't have to wear it anymore. Patients almost a bit scared to take it off.
Yeah.
It's a very comfortable garment as well. So we obviously, prior to launching this bra, we tested it on quite a few case studies as well, but you kindly tested it on one of your case studies yourself. So a real life exploitation patient, one of the first that got to try this bra. And do you want to tell me a little bit, how was her feedback?
Yeah, I mean, the feedback was pretty positive, actually. She liked it a lot. It was comfortable. She wore it for the full 6 weeks. So her experience was very positive. But from my perspective, when I reviewed her, I also felt that it did exactly what we needed it to do. That we didn't have issues with seroma, nor with excess swelling. But I felt that the breast shape molded quite well. So I think both from the surgeon and from the patient perspective, it was really quite encouraging.
Brilliant. So we obviously we involved your expertise into this, but we also asked quite a few manual lymphatic drainage therapists as well, and hence why this bra, as opposed to all the other macom bra, which got quite narrow straps, this one has slightly wider straps, and it goes all the way up to the axilla. And we will explain from a manual lymphatic drainage point of view that it helps to drain, optimize the lymphatic drainage if you've got compression all the way up here and here. So that is one of the reasons why the design of the Explant bra looks slightly different than all the other macom bras. And it comes a little bit further down, so it's got a slightly more long line. So if you have any swelling, obviously swelling goes down with gravity. So hopefully should help with that as well.
Mm-hmm. I think the other thing that's really good, and this is maybe, you know, you can shed more light on this, is the sizing of it is very easy, because clearly people are worried, you know, when you have the implants removed, what size would they be, you know, what bra to get. But I think that works very well when they phone your office.
Yeah. So the sizing protocols with all the macom bras always been to make things as straightforward as could possibly be. So we could go according to high street bra sizing. So we will never need to know someone's size prior to have explantation. So whether you were an A or a B cup, it's not quite relevant to us whether you had a 210 or 460 cc implant. It doesn't matter, because breast implants don't measure in ABCD cup size as we're familiar with them in the high street. So we just need to know the high street back size. So 32, 34, 36. Obviously in other countries, they will be different. Because the measurement underneath the bust, under the IMF, that is not going to change after the procedure. It's just the bust itself. So because it's retractable, you buy, so if I'm a 34 before the procedure, I get a 34 bra, which is a medium in macom, and then the cups will retract back to whatever size the patient's going to be after the explantation. So yes, you're right. Sizing protocol, we always try to make it as easy as possible. And I think that shouldn't be underestimated. You know, patients are quite nervous about many other things, which you really helped to clear up today, I think, for a lot of women considering this procedure. But sizing shouldn't be one of the things they should worry about in terms of what size to get in their compression bra. So I'm really grateful for taking the time to help us answer some of these frequently asked questions that we do get. So thank you for that.
Happy to help. I think, thank you also, because this is a really important topic, you know, implant removal, capsulectomy, the whole area. I don't think really is talked about enough, certainly in the mainstream. And so I think well done for coming up with a product that was much needed, and also for bringing this topic to the fore.
Thank you. It's a pleasure. And hopefully we'll have more conversations like this moving forward. And ultimately try to help these women who are going through this. I personally have had friends who've had explantation, and I really understand what goes through someone's mind to decide to have something removed from their body, which, you know, I'm not saying breast implants signify someone's femininity, but deciding to have them removed is a big decision for a lot of women. So yes, thank you for helping out. I really appreciate it.
Happy to. Take care now.
Okay, have a lovely day. Thank you.
Yeah, bye-bye.